Okay, so now we're on to the lower part of the leg, the tibia and fibula. On this picture of the bones, this is the anterior side. So this is the front. Here's the posterior side. This is of the same bone. It's just the front and back of it. So first of all, can you figure out which leg is this? Is this the left or the right leg? So if we look at this front one, the front side, you notice the fibula is on this side of the tibia. Now the fibula is always lateral. So it's on the outside of your leg. So this would be the median line. And so since the fibula is always on the outside of your leg, and this is the front of the tibia, this is the front of the tibia and fibula, this would be considered the right leg. Up here at the top, I also want to point out that this is the patella. That's your kneecap. So this would be the front of the kneecap. This would be the back of the kneecap. Do you see this cartilage right in here? The smooth section? So we know that that's going to be the back of the patella where it connects to the knee joint. Also, there's some other things that I want to point out on this picture. If you notice that here's the fibula and here's the tibia, and there is a space in between here, in between the two bones. Now this actually isn't just open air like it shows on this picture. There is a membrane that connects, that attaches to both bones and connects the two, and it's a pliable membrane, but it kind of keeps them both together, and this is called the interosseous membrane. Now inter, remember, means between, and osseous is just a term for bones. If you remember when you were studying the bones, the bone cell is called an osteon. Now if you notice on the top of the tibia here, you can see that there are these smooth sections on the top here. And why are they smooth? Because they articulate or connect with the femur that's up here. I'm just going to write this over the kneecap, over the patella, but the femur actually comes down behind the patella and connects on top of the tibia like that. So between the two bones, you have to have smooth surfaces so they don't grind together if they touch. So what are those smooth surfaces of the bones called where they connect to other bones? That's right, they're called condyles. And we'll get more into the condyles of the tibia later. Also, I want to point out down here on the very bottom, on the bottom of the fibula, do you see how the fibula extends down and it makes a little bump right here? And see on the back here, you can see it extends down and there's this little bump right there. So you can kind of consider it, that's kind of part of your outside ankle, your lateral ankle. And then you see the tibia as it comes out and sticks out into the median line. Remember, the bones of the limbs always stick out more, see further, than laterally. Laterally, they don't stick out too much. So we know this is the medial side, the inside of the inners of our legs. So this section of the tibia that sticks out down here at the bottom, you can kind of consider that your inside ankle. And these ankle bumps, as you want to call them, the bumps on both the tibia and the fibula, laterally and medially, they're called a malleolus. And just consider malleolus to be a word for your ankle. I don't know if it actually means ankle. This is going to be the name for these features of these bones. So just remember the word malleolus. Also, I just want to point out where these bones meet. Up here, the tibia and the fibula meet right here. And on the back, look how it is on the back. It connects like that. So really the tibia makes up most of the knee joint with the tibial condyles. And the fibula connects down a little bit lower than the tibial condyles. And where these connect is called the tibio-fibular joint. So that's pretty easy to remember because it's a joint in between the tibia and the fibula. And the one on the top here, you just want to put the term superior. You just want to add the term superior before the rest of the term. So these would be the superior tibiofibular joints. So if that's the superior, if those are the superior tibiofibular joints, down here at the bottom where the tibia and the fibula meet, right here, what would these be called? That's right, these would be called the inferior tibiofibular joint. Now your shin bone is just the anterior surface of the tibia, and that's where your shin is, and we call this the anterior margin. So that's your shin bone. Your shin bone is part of the tibia, and it's called the anterior margin of the tibia. The top here, of course, is the head of the fibula. It's over here too. The head of the fibula. And now let's look at the next picture to identify all the rest of the features of the tibia and fibula. Now here's a good picture of the tibia and fibula. These are real bones, a picture of real bones. And here's the anterior view, so this is the front. Here's the posterior view, so this is the back. So this is going to be the right leg, because you see on the anterior view, the fibula is on the outside, it's lateral. And the tibia would be medial. It's going to be closer to the midline of the body. Now first let's start up here at the top of the tibia where it connects to the knee joint. So the femur comes down, and the femur is going to be right up here, right above the tibia. And the tibia, since it's connecting to the femur, is going to have condyles on the top. There's two of them, because the femur has two condyles to match up with the two condyles of the tibia right here. So this would be on the medial side. This condyle would be on the medial side. So it would be the medial tibial condyle. And so of course this other one is going to be the lateral tibial condyle. And over here on the posterior view, you can see the shape better of the condyles. You see how this comes up right here, and then this comes up right here. So this would be where the condyles are. And again, the condyles are just flat, smooth surface that articulates where it articulates with another bone. Articulate just means joins up, connects together. Now between these condyles is, if you look on the posterior view right here, between these condyles is going to be this little notch, this little indentation, or this little space of the part of the bone that go in between the condyles. So this is going to be the intercondylar, inter meaning between, condylar meaning condyles, so between the condyles, intercondylar eminence. So that's the little part of the section of the bone that go between the two condyles, and you can just sort of infer it right here. If you look on the top of the tibia, if we could look from the top looking down, you'd be able to see this section of the bone that goes in between these two condyles. Now what I really want to get into and show you is this space right here, this area right here of the tibia. This is the anterior section of the tibia in the front, and this is like a rough bumpy patch right here, and it's on the front of the tibia below those condyles. Here's the condyles. So this rough bumpy patch, this rough patch on the bone, a rough patch on the bone is called a tuberosity. And since it's on the tibia, we call it the tibial tuberosity. And what is a tuberosity? It's just a rough patch of the bone where a muscle connects. And finally, down here on the bottom, I showed you the way the fibula comes out into a little bump right here, and the tibia on the inside of your leg comes down into a little bump right there. And we call those the malleolus. So this one on the inside, on the tibia, because each has one, the tibia has a malleolus to go on the inside of your leg, and the fibula has a malleolus to go on the outside of your leg. So the tibia, the tibial malleolus, is just called the medial malleolus because it's on the medial side. And of course the malleolus on the fibula is just going to be called the lateral malleolus. So here's a 3D image of the tibia. So we can turn it around like that and look at it. This is the anterior surface of the tibia. This is the front. This would be your shin bone. So that's the anterior border right here. Just that little green line, anterior border. Right up here is what I was talking about, the tibial tuberosity. Now up here you can see that there's the condyles. You can see the sides of the condyles, because the condyles are actually on the top of the tibia, because that's where they articulate with the fibula. You see this tibia, it sticks out more on this side, so this would be the medial malleolus, and that's part of the medial malleolus would be on the inside of your foot, and that would be part of your ankle bone, the bumps around your ankle. So as we turn this around to the other side, this would be the side that connects to the fibula. So this would be where the interosseous membrane connects. See, it says interosseous border. That's just where the membrane connects that spans between the fibula and the tibia. And if you turn it around to the back, this is the posterior side of the tibia. This is obviously the inside of your foot, the medial side, and here's the medial malleolus, the back of it. And these lines are, here's the cilial line and the vertical line. You don't need to memorize those for your bones, but you do need to know about them, because you need to know where that's sections where the muscles attach when you learn the muscles. Now, right in between the condyles is this groove, and it's called the intercondylar fossa. Inter meaning between, condylar meaning condyle, so between the condyles, and a fossa is just a little depression in between them. And this is, they also, on here, they call it the posterior intercondylar fossa because it's on the posterior side of the tibia. If you turn it around and look at the front of the tibia, this is going to be the anterior intercondylar fossa. But where it sticks up at, there's the intercondylar eminence. So the eminence is the bump that sticks up in between the condyles, the intercondylar eminence. And then the intercondylar fossa would be the depression between the two condyles. Now here is the top of the tibia. So you can see here is the front of the tibia. So this would be the tibial tuberosity. You see this bump coming out, and there's a rough patch on the front of the tibia right here. But you can see the condyles a lot better. Here's the lateral condyle. Here's the medial condyle. And the outside are the borders. This is just the border. These are called plateaus, the tibial plateau. Tibial plateau. I don't think you need to memorize that for your bones, but you do need to understand that these condyles are the smooth surfaces that connect in the knee. And once again, here's the tibial tuberosity, the rough area where muscles connect. This is a tubercle, which also, remember the T words, except for transverse, but the tuber words and tuberosity and tubercle are rough patches. The tubercle is more of a bump, and the tuberosity is more of a rough patch. But this tubercle is also where things connect. It's called Gerdy's tubercle, but I don't think you need to memorize that for the bones. But you should be aware of the fact that there's tubercles and places for muscles to attach all around the top of the tibia here. Now here's the fibula. And so here is the inside of the fibula. This would be the interosseous border. That's where the interosseous membrane attaches to attach it to the tibia. Here's the anterior border. So this is the front. This is the anterior of the fibula. Here's the head up here. And then there's a little tiny styloid process that sticks out there. What's a styloid process? Well, remember, a process is a section of a bone that sticks out. That's all process means. And styloid is like in the shape of a stylus pen. It just means it's real pointy. It comes out as a little pointy section that sticks out from the bone. So styloid process. And that's at the top of the fibula. And this whole side of the fibula, the head and the styloid process that connects to the tibia right here. The tibia would be right next to it over here on this side. Here would be the outside of the leg, the lateral section. And down here, see how this bumps out? This is the lateral malleolus. Here's the neck of the fibula. Obviously, it's going to be right below the head. And if we turn this around, this would be laterally on the outside. Here's the back. And it's pretty much the same thing. See, the styloid process sticks up. Here's the medial malleolus, and do you see where it goes down a lot more, extends down? So that would be the bump, starting your ankle bump on the outside of your leg. And that's pretty much it for the fibula.